Good evening. Let's call this meeting to order. The Champaign County Board Committee of the Whole for Finance, Policy, Personnel Appointments, Justice and Social Services. The time is 6:32. Roll call, please.
Tinsley,
Present.
Vashaspati,
Here.
Anderson, Clemens,
Here.
Clifford, Coert, Douglas, Eisenman,
Here.
Esri,
Here.
Furtado, Goss,
Here.
Harper,
Here.
McGuire, Mitchell, Patterson,
Here.
Petrie,
Present.
Quisenberry, Rector, Rosales,
Here.
Storr, Summers, Weibel.
President, we have a quorum. Seek approval of the agenda and the addenda. Moved by Mr. Rosales, second by Mr. Goss. Just want to point out in your yellow folder, the first item, budget amendment, is a revised version of the one that's in the package. Strictly, one of the account numbers is wrong. The dollar signs are the same, just the account number is wrong. Any other discussion of the agenda or the addenda? Seeing none, all in favor? Aye. All opposed? Motion carries. Seek approval of the minutes of the Committee of the Whole, October 9th, 2018. Moved by Mr. Vashapati, second by Mr. Patterson. Discussion of the minutes? Seeing none, all in favor? Aye. All opposed? Motion carries. Seek approval of the County Executive Transition Committee minutes of November 1, 2018. Moved by Mr. Patterson, second by Mr. Vashapati. Discussion of those minutes, please. Seeing none, all in favor? Aye. All opposed, motion carries. Public participation. We have one person tonight signed up so far. Is it Cherry Hayes? Please step up to the microphone.
Hello.
You don't need to sit down. Yeah, get closer. Put the microphone right at your chin would be best. And you have 5 minutes.
Okay. The reason I'm here is because my husband passed away and your corner is out of control. It took me 4 months and a week to get my death certificate. I was told from the second month on it'd be 2 weeks, 2 weeks, 2 weeks. I offered to write a letter to the board, to you people, stating that they didn't have enough help, and I was told by one of the deputy coroners that they would get in trouble if I did that. At the 4-month mark, I called the coroner himself. The man, first of all, told me that it was my fault that I didn't have a death certificate because I didn't have an autopsy done. I was told by Carl Foundation Hospital I did not need an autopsy. They had everything they needed. Then he told me that the Carl doctors and the Gift of Hope people were liars and would say anything to get the organs. Then he basically asked me what I wanted on the death certificate and why was my insurance not going to pay, depending on what he put. And then when I explained to him that I needed that for the insurance and they were going to pay, it didn't matter what he put on there. He basically told me that he didn't care if my insurance expired in 2 weeks, he would get it to me when he got it to me. And a few other things that right at this moment I can't remember, but he was very rude. I've lost a loved one, and 4 months is a long time to not be able to get your death certificate to get the insurance. Luckily, I had a stepmom who stepped in and paid the funeral, but not everybody does. And I was told the first month that they had several people in front of me. Can you imagine? And at the 3rd month, there was still one in front of me. Our funeral home called to check on the death certificate and was told that if people would stop calling, they might get them done. And I mean, that's not good business, period, whether it's death or life or whatever, for a coroner to act like he has no compassion. And I do have one. I threatened the man with filing a complaint with the Illinois Attorney General And I did talk to Jim Goss, and he was nice enough to email him, which is the day that he signed it. I also talked to Carol Almond. I guess she's one of your Congress people. Well, Rice's office told me how to pronounce it, so I wasn't sure I was doing it right. He called the man personally. I mean, it's just, 4 months is too long, and no coroner should talk to anybody like they're not. I mean, I wasn't the one that did what happened to my husband. All I need was the death certificate. And then it took me about a week and a half to get it from the courthouse because we had to mail it in. I couldn't take off work to come up here and get it. But it's still the point. 4 months is too long. I don't know if they don't have enough help. I don't know what was going on up there, but, and then to be told that they were going to get in trouble if I came to the board and said something, that's even worse. But he was very rude. Tracy was the deputy coroner I dealt with, and she was very polite, and she apologized every time. But it's the fact that it went on for 4 months. And my husband died at a hospital, so it wasn't like he was killed somewhere on a road or, you know, by somebody they were looking for. This was, according to the doctors, they had everything they needed. And if he's going to call Carl lawyers or Carl doctors liars, what's that going to do to people that come to Carl Hospital? You know, I don't want to hear the doctors and the Gift of Hope people were liars. You know, that would make me think twice before I brought another loved one here, which it won't, because I know the doctors that were in charge of my husband, and they did everything in their power. But it's still the point that your coroner was totally out of order and had no compassion, no anything. I even asked him if he was going to pay the interest on the funeral. And he laughed at me. It's, you know, and that's not funny because every month that went, it was interest. And that's all I have to say. I think that you guys need to set some rules for him and maybe not let him talk to a person who's lost a loved one.
Thank you. Is there anybody else who wants to participate in public participation at this time? Okay, we'll close that. Any communications among the county board members? All right. Oh, Chris, you don't have to. He's going to.
Tomorrow is going to be an anti-stigma event that's going to be held at the First United Methodist Church in Rantoul from 1 to 3 o'clock. The speaker will be Dr. Julian Rappaport, a well-known professor on peer-to-peer counseling. And also there'll be a testimony of a person from the GROW group about the difficulties of a person going through mental health recovery and trying to reestablish relationships with their family. And you're all invited to attend.
Any other announcements? Okay, let's move on to Justice and Social Services. Mr. McGuire.
Thank you, Mr. Chairman. First, of course, we have our monthly reports: Animal Control, Emergency Management Agency, Head Start, Public Defender, Probation and Court Services, Veterans Assistance Commission. Without concern, we'll place those on file. Secondly, Justice B, Emergency Management Agency, request approval of an application for, and if awarded, acceptance of Illinois Emergency Management Agency Performance Grant, term 10/1/2018 to 12/31/2019. Second, Lorraine. Is there any discussion? All in favor? Aye. All opposed? I did this. You don't. If you want to discuss it, you better get in there fast. Okay, thank you. Motion passes. Thank you. Other business. There is no chair's report. Designated items, of course, will be B1, unless John has something else he wants to say.
Thank you, Mr. McGuire. Next up is policy personnel appointments, Mr. Rosales.
Okay, I believe we have a presentation of, on the Illinois State Association of County Membership.
Yes, I can introduce, our speaker today is David Zimmerman, who's the current county board chair for Tazewell County. I think you've been chair for, what, 8 years? Is that correct? 10 years, okay. As you know, as we previously talked about, there's a new statewide county board membership called the Illinois State Association of Counties. And Dave, I asked Dave to come over and talk about it. Tazewell has agreed to join this. I asked Dave to come over and maybe convince us why we should join.
All right. Well, thanks, Chairman, and thanks, Board, for allowing me. I'm not used to being on this side. I'd rather be up there, but I'm David Zimmerman. I live in Morton, Illinois. We're the pumpkin capital of the world, right up 74. Just like Illinois, the counties in this state are fractured, and there are multiple organizations. Tazewell County has always been in every one of the organizations. I don't know if that's just to cover ourselves or what, but just a real quick history. Champaign County has been in NACO, which is the National Association of County Officials. It's an outstanding organization. Your dues in that organization are just over $4,000 a year. You used to be in metro counties, and that organization has kind of dissolved. Your dues were just over $9,000 for that organization. You are currently in UCCI, United Counties Council, which does a great job in providing education and some lobbying efforts. Their dues are approximately, I'm guessing for Champaign County, $2,500, but they're reimbursed every year 100%, so it's essentially free to be in that organization. There's the Illinois Association of County Board Members and Commissioners. I don't know if you're in that organization. And then we have the new organization, ISACO. So there is going to be a quiz on all these acronyms. So that's the Illinois State Association of County Officials. And if you would so choose to join this, your dues would be $8,500 approximately. What this new organization hopes to do is provide a single voice down in Springfield. So right now with so many different organizations, a particular legislator may get 3 different opinions, many of them contrary to each other when they go down to the county. They'll have a hired full-time lobbyist. They'll have a dedicated office. They've already rented the space and hired an executive director who came over from the IML. IML does a great job in lobbying, so I think his experience is really going to be beneficial to the counties. Within ISACO, there's going to be 3 caucuses. There'll be the Collar County Caucus, which will be Northeast Illinois. There'll be the Large County Caucus, which will be the top 20 counties in Illinois. Tazewell will be a part of that. If you choose to join, so would Champaign. And then there's a Rural County Caucus. And I think the idea is to have a lobbyist for each one of these organizations speaking for counties down there. I know it's kind of late in the budget process. We wrapped up our budget at the end of last month. But I see on your other business towards the end that UCCI this year, in lieu of reimbursing their dues, which are about $2,500, they're offering to pay.
Actually, if I can correct you on that, they are reimbursing the dues and they're offering to pay for NACO for next year.
Right, exactly. And that memo came through today that they are going to do that. So you won't have to pay anything for NACO, and you'll get your dues reimbursed. So that may not cover the full $8,500, but I think it's a new organization. We're going to give them an opportunity. Give them a couple years to see what they can do, and I really think it's worth the investment when I see what they do to counties on a consistent basis with their unfunded mandates and their taking away our dedicated revenue streams. We need somebody down there speaking for us. So happy to answer any questions, but.
Well, thank you very much, Mr. Zimmerman, for making this truck
Yeah.
on such a cold evening.
Oh, that's all
I hope
right.
that we have extended a warm welcome to you, to our county board.
Thank you so
There
much.
was many questions because we belong to several organizations, and we wanted to get that from you and your organization as to what were some of the benefits and some of the things that you covered that other organizations didn't cover. So with that, I'd open up the floor for any discussion, questions, concerns. Patsy?
Hi,
Patsy.
welcome. Nice to see you.
Good to see you, too.
Okay, I have probably a long list of questions.
You used to do this at UCCI,
I
too,
know.
if I remember
I
right.
know.
That's right.
Yep. Okay, so far, how many counties have joined this new organization?
Okay, just off the top of my head, Washington County, Kendall, all the collar counties. There's probably a dozen right now.
Okay, and when I was at the UCCI dinner, what I was told is that, what are there, 7 seats on a board, and UCCI got one. The Illinois Association of County Board members chose not to take a seat, so UCCI got 2.
That's correct.
Could you talk a little bit more about that to help us understand? Because you talked about this tripartite of lobbyists, so
Right, right.
that would be useful.
Right. So I'm trying to think of the makeup right now. Deb Sims, who's a commissioner on the Cook County Board, and Jim Healy from DuPage County are I think the president and vice president. UCCI has 2 members.
Right.
I'm a member of that board representing the large county caucus. And there are several other commissioners. I'm not sure the total number of the executive board.
Okay, so the purpose of the executive board as juxtaposition to these other 3 aspects, how are they working together?
They'll work together as one. I mean, you'll have the executive board, but then underneath that board, you'll have these 3 caucuses. You know, Cook County and the collars have issues, some that are similar to ours, but
Not really.
they have a lot that are
Yeah.
not. And so they'll have their dedicated lobbyists to speak to their issues. But it requires a majority vote, so if Cook County wants it and the rest don't, it won't happen. But they have a staff of lobbyists that work for Cook County that
Okay.
are dedicated anyway.
So this offer to all of the UCCI membership, which my understanding is that there's 64 members, but only 58 will get help because 6 of those already belong because they're in the major counties. Do I understand that correctly? So UCCI will bring 58 potentially into NACO, which will give UCCI some strength at the table. Is that correct?
So are we talking about ISACO, which is the new organization, or NACO, the big organization?
No, I'm talking about what UCCI has offered to
Right.
the UCCI members in helping pay for that membership. But it's my understanding, one of the reasons for that offer is that then it strengthens UCCI's
Correct.
position at the table, even though they have 2 positions. This is going to strengthen their
Right,
position
right.
at the executive table, correct?
Exactly,
Do I
exactly.
understand
Yes.
correctly?
Right.
Okay, but out of the 64 members of UCCI, there's only 58 that will get this help because 6 of them already belong to this new organization. Is that correct? Did I understand that correctly?
So I don't know how many of I think it's actually 68 members of UCCI
Okay, then I
belong
misremembered.
to NACO. I don't know what that number is,
Okay,
but they're offering to bring all 68 in.
Okay.
Tazewell County's already in. I mean, we'll benefit because they'll pay our dues also.
okay. All right,
Thank you very much, Patsy.
yeah, I think that's all I have right now.
We have Jim. Jim, I saw your hand go up and down. You sure we exhausted all your questions, Patsy? I knew you. Thank you for
Right.
sharing.
I knew I had another one.
Yes.
Okay, so this organization is coming on board, and we have the Illinois Association of County Board members, and we have UCCI here. How are those two organizations going to dovetail into this, especially since the Illinois Association of County Board members chose not to take a place at the table, right, at this point in time.
Right. And I can't speak for that organization. We belong to that, but they pretty much stepped back from this completely. I don't know where they stand on that.
Okay, and has UCCI made a commitment as to how many years they're willing to pay the membership to NACO?
1 year at a time.
That's what I was told.
Right.
Okay, thanks.
Are there any further comments, questions you have for Mr. Zimmerman?
Thanks for the opportunity to speak.
See none, thank you very much for
Thank you,
coming
David.
out here. There is coffee in the back that you could help yourself to.
I have a
for
daughter that
the
lives in
road
town, so
home.
it works out great, so.
Definitely, appreciate you
Thank
coming
you.
out.
Okay.
Thank you. Okay, so we move on to appointments and reappointments. Deputy Sheriff Merit Commission Board, term 12/1/2018 through November 30th, 2024. Pius?
I move the nomination of Sammy Anderson.
Okay, moved by Pius, second by Rector. Any comments? Seeing none, all of those in favor? Aye. Opposed? Great, thank you. Animal Control Administrator, term 12/1/2018 through November 30th, 2020. Applicant
I move
is
the nomination of Stephanie Jose.
moved by Pius, second by Asri. Any comments? Questions? All those in favor? Aye. Opposed? Great. 3, Public Aid Appeals Committee, term 12/1/2018 through November 30th, 2024. This is a Republican seat, I believe. Applicant?
I nominate Mr. James Rusk.
Okay, moved by Pius, second by Anderson. All those in favor? Pardon? Question?
Just for the record, I want to recuse myself.
Okay. One excuse? Any,
Don't we need a reason?
You need to state why.
I'm employed by the Cunningham Township Supervisor's Office, so any appeal that would come from my office would likely involve me, so.
okay, due to the fact that he's an employee of the county, he's reclusing himself. Thank you very much. I didn't want to personally ask that, but thank you, Esri, for bringing it up and reminding me. Senior Service Advisor, oh, okay, a vote. All those in favor? All those opposed? Motion passes. Thank you. Senior Service Advisory Committee, there are various terms here. How do you want to do this, Pius? Why don't you read them?
I'll do, oh, yeah, I'll nominate Sonia Vickers for unexpired term ending November 30th, 2020. Cynthia Bell, unexpired term ending November 30th, 2019. Jimmy Kaiser, unexpired term ending November 30th, 2019. Linda Haskell, term from December 1, 2018 to November 30th, 2021. And Tammy Fruling Voges, term from December 1, 2018 to November 30th, 2021.
Okay, Pius moved. Could we get a second? Second by Harper. All those, no, before we vote, any comments, questions? Seeing none, all those in favor? Aye. All those opposed? Great, motion passes. Number 5, Zoning Board of Appeals, 3 positions, term 12/1/2018 through October 30th, 2023. Applicants are, yes, Anderson.
I'd like to ask that we vote on these individually.
Okay, I see no problems with that. Pius, you want to do that?
All right, I'll move Lawrence Wood.
Okay, moved by Pius Theodore, second by Esri. Comments, questions? Seeing none. All those in favor? Oh, Patsy?
I didn't have time to look this up, so could you, even though we're voting on them one at a time, just review that there are term limits on the ZBA, correct? 2 terms?
I don't think so, no. I think it's sort of traditional.
No, I thought so.
Pardon? Actually, I don't know.
Oh, because Kathy Capel is going off
Hold on, Mr. Thorson, would you step up to the microphone, please? We have an experienced ZBAer here. Actually, no, it comes back now, there is a term limit. It's back in my mind, it's
It is
foggy
2
there.
terms, isn't
'Cause
it?
that's why Doug Rice got off a
If you
couple of
made
years
me
ago.
walk this far, I'm going to talk. Yeah, I'm the former chair of the ZBA. I served 2 terms, 5 years each. That's your maximum. You
Right.
can reapply later on, as far as I know, provided you meet the criteria.
Okay, thank you.
Okay.
Thank
Thank
you.
you, Eric.
Thank you, Ms. Petrie. Go ahead.
Okay, all those in favor?
Aye.
Aye.
All those opposed? Motion passes. Second,
Nomination Marilyn Lee for another term.
second,
Second.
second Esri, moved by Pius. Discussion? Seeing none. All those in favor?
Aye.
Aye.
All those opposed? Motion passes. The next one, Lawrence Wood.
No.
No, I already did him.
What was that?
I actually am not going to nominate Mr. Hartke. Mr. Hartke has been involved a lot in ZBA hearings of late, and that's actually the problem. He's been involved, I think, in some very heated discussions. I think that if he would join ZBA right now, he may have some axes to grind. I think he needs some time distance between now and when he may apply again in the future, so therefore I'm not going to nominate him, and we'll open that position up for other appointees.
Could I get a second? Don't need a second? Good. No nomination, no motion? Good. We move on to Marilyn Lee. Oh, we're done. Hey, I like that. Now, we're on C, the Sheriff's Office. Request evaluation of crime analysis analyst, position by the Job Content Evaluation Committee. What do we do with this? Okay, moved by Pius, second by Summers. Discussion? Stephanie?
Just thank you for moving this forward. This is very important, and I appreciate that it's going to
Being
this
moved
next
forward.
step. Yeah.
Any further discussion? That's your spotty.
I agree with Mr. Furtado. My only question is, the actual position isn't here, so the motion is to request, the motion is to request that the job description be created? Okay.
Okay. Did that get answered for you?
I think the motion is to request that the job go to the Job Content Evaluation Committee for creation. There is a questionnaire that the sheriff will complete that defines what his vision is for the job, and from that, we'll develop a job description and bring that back with the classification recommendation to the policy committee.
Any further comments, questions? Kyle?
And I just want to state for the record that this is part of the recommendations of the Racial Justice Task Force, and the funds that we earmarked for this upcoming budget are going to go to fund this position.
Correct. All those in favor? Opposed? Great, motion passes. Item D, County Board of Health. This one, we're going to need some help from Vera Weiss. Okay, let me put the motion on the floor. Request approval of revised Appendix 8 to agreement between the CUPHD and the County of Champaign and Champaign County Health Department for the provision of public health services by CUPHD to the Champaign County Health Department. Moved by Beshaspati, second by Kyle. All those in favor? Discussion. Discussion? Seeing none? Okay, Dottie, I'm sorry. Trying to rush things here.
So, good evening. I've been before this group a number of times on a variety of issues. Some of you may not realize that you have also appointed me to be on the County Board of Health, and my background includes being a retired family physician, a former member of a health department, an assistant health officer out in San Mateo County in California. And so many of the issues that are on this list are things that I'm very familiar with. And also, I won't go into a long description of it, but the purpose of public health is basically to provide for the health of the public in general, and that includes doing things where the causes of illness or injury are beyond the control of an individual, to take care of them and prevent them, such as doing the evaluation of Legionnaire's disease outbreaks, and also to do safety recommendations to prevent foodborne illnesses, and also to provide for health education in situations where that's going to be important in preventing diseases such as sexually transmitted diseases and things like teen pregnancy. And finally, for our purposes tonight, to include dealing with emergency situations. And that is a joint responsibility of often emergency management associations as well as public health departments, which are more involved in some things like toxins and other kinds of situations. So Appendix A, I think that you have it in your packet. And there are three main categories of issues that are included in here. One is environmental health, and the environmental health staff are here to answer more specific questions about that as well. Wellness and health promotion, the issues of tobacco exposure prevention and preventing new onset of smoking among youth and nicotine use, which can be in the electronic cigarettes, are very important to the health of our communities. And you might say that if people are vaping, they're not exposing other people to secondhand smoke. One of the things that we realize now as being contagious are behaviors, where especially with teens, when they see others doing certain behaviors, especially their peers, they're very likely to take them on. And so that's why this is an appropriate area to include in the prevention activities. Teen pregnancy prevention and sexually transmitted disease concerns. Again, this is an issue where young people who are exposed to everything that's in the media and what's going on in their schools and their classrooms don't always have the information that they need. And so when there are higher incidents of those problems, or if a school requests it, then the health department will either, depending on the situation, use funding from the state for high minority schools, or funding from the Board of Health and from the county itself to provide the education. And then another area is where services are not easily available. So dental services for children who don't have easy access to it are also included. And then finally, the emergency preparedness. I think that most people agree that this is one of the areas where you do need a public approach to it. It's not just individuals. And I was very much involved in bioterrorism prevention and response preparedness when I initially worked with San Mateo County Health Department shortly after the 9/11 attacks. So I hope that you will agree that these are appropriate things to be done, and that the portions of the county that are not within the CU Public Health District deserve to have these services as well, and that you will approve this part of it and approve Appendix A.
Thank you very much, Dr. Weiss.
You're welcome.
Any further comments? Yes, Chris?
Thank you. I saw the water well testing for non-valid public health significance required, and I noticed that the that this is only for coliform and not for any other chemicals. This is probably in need of updating, and
Okay, so just my initial response to that is that if there's a valid public health concern, then it's covered by other funding and by other programs. So this is if somebody comes in and says, hey, I'm just wondering whether this is in my water system, and there's not a known public health case or specific reason to be pursuing that. And I'm going to just look to the environmental health people for anything else, because they deal with it on a more specific basis. And I think you know Jim Roberts, who's Director of Environment.
Jim Roberts, Director of Environmental. There you go. All right. Yes, we have a grant from the Illinois Department of Public Health that covers certain services. And then many years ago, the County Board of Health looked at what services were not required or were not covered underneath the grant. And this was one of those, doing water well testing, so it became a fee for service. And yes, we only use for coliforms. We used to do nitrates, and we use the Illinois Department of Public Health Laboratory, which no longer tests for nitrates, and so they just test for coliforms. And there are other services like the Illinois Water Survey that will test for some of the minerals in it that one may be interested in.
okay, thank you.
Thank you for that question, Chris. Are there any further comments, questions? Patsy?
Hi, Dottie, thanks for coming. I have one question specific to this appendix. And under wellness, I don't see anything related to mental health activities. Is there a reason that those are not included under that category?
That's an important question. I would say that we have been dealing with issues of the of opioid prevention and preventing transmission of sexually transmitted diseases through that substance abuse approach. And there has been some overlap in what we've done. The Department of Public Health participates in the formation of the I-Plan, which is a 3-year plan for improving public health. And one of the 3 focus areas on that has, for a number of years, been dealing with mental health issues. And so energy is being put into that. This is an area where there's kind of in some ways, a cooperative attitude between public health and the mental health board about how it's approached.
So in your opinion, should that be included under the wellness and health, just to be certain that it is covered and it is stated in the document?
Since this is not an area where the Board of Health works with the Public Health District for specific services, I mean, this Appendix A is specific services that the Public Health Department is providing to the county areas. I don't know that it needs to be in there.
So then how is the county serviced?
Through the Mental Health Board. And
Just
then,
through the mental health board totally?
right, and then also by the fact that it's in the I-Plan and that we're working on that. But that's, I don't know that it needs to be added in here, and I'm wondering whether it's something we might consider for the revised Appendix A that we'll bring back next year.
Well, I would appreciate that being put in a tickler file so it can be considered so that the county is enveloped in anything that's offered in the way of mental health, and so that it isn't doubt. There's some cracks in the sidewalk in relationship to people understanding where they can go and where they can't go for these kind of services. So that might be the usefulness of doing that.
Okay, and also, as I think you probably know, the Promise Healthcare, which operates Francis Nelson Clinic, they provide mental health services as part of their kind of spectrum of activity, and it's really important that it be integrated into the physical health realm and services, and so that's one of the ways in which those issues are being addressed.
Right.
And there's a lot of coordination between the Public Health Department and Promise Healthcare, as well as other county services.
Okay, I'm glad to hear that, but when I listen and attend mental health board meetings, one of my takeaways is the higher need we need to work on within our county for that collaboration and how that information gets out to the general public. And so I'm encouraged to hear that you are talking about that, but I'd like to see even more of that occur. Okay? And
thank you.
This is a moot point because we voted on it, but nobody ever came to the board to explain the request of a 10-year request, and we voted on 5 years, which has been the case. Do you have any explanation why that request was submitted?
The thought was that there was no basic change in it, and it's a lot of hassle to go through. And since the contract already included a provision where it could be modified at any point at the request of either party, it seemed like maybe it made sense just to extend it to 10 years. There was nothing beyond that, and no intention of trying to get out of having a review of it. Okay, thank you. Yeah, you're welcome.
Thank you, Dr. Weiss. We still have a few questions. Pius?
Yeah, I just have a comment. I thought it was a couple weeks ago, there's an article in the News Gazette about your teen pregnancy and sexual transmitted disease program. And the article pointed out that a number of the schools are very, very encouraged by the program, and we're very actually thankful that you have this program available, and they were looking forward to it. So thank you.
Thank you, Pius.
You're
Steve?
welcome.
If you could just help me, in terms of coverage for the child dental service, I was just curious about it says services to children 0 to 18 living in Savoy, Illinois, who are covered appropriately by Medicaid and Medicaid managed care organization. Is that restricted to the village of Savoy?
Okay, I didn't hear your question real clearly,
Okay.
but
It's about
a number of
coverage
children
parameters.
in that area are in receiving other services from the health department,
Okay.
so that it, in terms of having fewer different places that they go to include them in the health department's dental services was one way of dealing with it. And that's both services on site, and there's a mobile clinic that's run by Smile Healthy that is also contracted with the health department.
But
With the
that's
health department.
exclusive to residents of the village of Savoy, is that correct?
I'm sorry, again, the PA system here I find a little fuzzy.
Sorry, I'm sorry. It's not the best, honestly.
If you turn your microphone off, it'll play from the stage.
Okay. The way it reads, dental services for children 0 to 18 living in Savoy, Illinois. And I'm just curious about, is that exclusive to Savoy? And then the second in EB, it's children 0 to 5 simply living in Champaign County. So I'm curious about coverage area and if I'm reading this correctly.
If I may, if I believe I remember correctly at the last meeting, the children in the village of Savoy attend Champaign Public Schools. So the Smile Healthy that goes to the rural schools do not service these kids, so they're putting them in this program.
Thank you. That answers my question.
Thank you very much, Mr. Clemens. As you know, he is the board representative to the Board of Health and can often answer questions that you have. But I'm happy to come here as well and be a resource.
Thank you for that clarity, Mr. Clemens. And thank you, Dr. Weiss, for coming and sharing this wealth of information. Oh, we have one more, and I know it has to deal with the school board question that you asked several weeks ago.
Okay.
Sure, go ahead.
Hi there. I've had several questions about letter D for the teen pregnancy and STD prevention education in schools, specifically with less than 40% minority. I actually have a son and daughter at Mahomet Junior High, so this is personal to me. And so I have already went in and spoken to the principal, and I just want to make sure that, is this something that schools can opt out of if they don't want it?
It's something they have to opt into. They need to request it.
Okay, so, and how would I know, like, that's not made clear enough to me. Like, I feel like we're voting and like that's a service that you're providing. Do you see what I'm saying? It doesn't say like a school can choose to have it or not.
Okay. That is the way it works. And again, I think it would be useful to be able to go ahead and, if you're willing to approve it with this wording, and we can add that specifics in the next revision. And I believe that you have received a letter from Julie Pride that clarifies that also. But she,
don't.
okay, or you will be receiving it.
I don't have that.
Okay.
I believe the school has to request the
Yeah.
service.
They absolutely have to.
They have to request
That
it.
is-
There's no solicitation for it. They have to request
Okay.
it.
I know it, yeah. Thank you, that's good to know. And I'm a school teacher, and so my biggest concern is always to the schools, and there's so much time, and they already have a great health program in place, and so I want to, and I would love to see the curriculum, if that would ever be available to people to view. Nobody else probably has an interest, but I do as a teacher. I'm sorry.
No, I understand that. I mean, that's really important. And basically, if I get the right letter. The curriculum would be based on the needs of the schools. CUPHD's health education staff has the resources, skills, and expertise to implement programming for the following topics that schools could choose from: sexually transmitted diseases, pregnancy prevention, birth control and condom demonstrations, anatomy and puberty, negotiating condom use and refusal skills, healthy versus unhealthy relationships, affirmative consent, and material specific to LGBTQ youth. And so these are the things that a school district could request and would be included as requested.
Okay.
Pius, and then McGuire.
I just want to point out, as a member of the board of the CU Public Health provides services. They do not force anybody to do anything, even with the exception, well, one exception might be TB. Somebody has active TB, they would try to quarantine that person, but they can't actually do that. They have to get law enforcement to do that. They provide services. They do not force services on anybody.
So it's optional, I believe. Clemens, you have, McGuire? Go ahead, McGuire,
Thank you.
and then Clemens.
Thank you, Dottie, for coming. I appreciate your work on the board and long-term work. It's good to have people that understand this information. And your presentation, the discussion kind of leads to that somehow we don't appreciate the work of the CUPHD, or don't understand what we're asking them to do. We have an issue with some of the duplicative services and the costs, and that we're being asked, the county's being asked to pay for it. Or it's a grant from the state, and is it duplicative work? The other issue I have is that for the last 3 months, we've been asking somebody to come talk to us about it, and yet again, we're being told we might receive a letter or the document may be changed again so that we might vote on it. And I don't understand why we have an issue from the health department with providing the information up front and being transparent in the first place. That's not something that you're responsible for. That's something the health department should be responsible for, and bringing the document to us and giving the information in the beginning so that we're not having these questions over and over again, and getting the information first so we can make a decision about it. So I'll be voting no about this because I don't think it would be a good idea, not because I don't think some of it is valid or important, just because I don't think we're being served well. Thank you.
Are there any further comments, questions? Thank you, McGuire. Stephanie?
I do want to point out that we have already voted yes on this with an appendix. So if we vote no on this, what would happen is the appendix that we already voted on, would still be in existence, right? So I guess if we do end up voting no on this, wouldn't there have to be some next step?
I don't know. I can tell you the CU Public Health Board has not voted on it because we're waiting for the county to
Yeah, okay,
do the final vote.
okay.
Dr. Weiss?
I don't actually know for sure if this is different than the one you saw before, if this Appendix A is different, or whether this was just an opportunity to explain it.
It is different. Previously, the appendix was just page 71.
Okay.
It was just the first page.
Okay.
Patsy, I see you scratching your head.
I do. I need to understand better before we vote where things stand in relationship to the concerns Jody expressed. Is that something that just a few words would be added to this to clarify that it's an opt-in rather than an opt-out? Or is that kind of instruction at the very beginning of the document to which this is an Appendix A, and that's just a duplication of information that's somewhere else in the document?
I think each school district has an option, and CU PhD is basically a resource. So you could opt to use those resources or not. Bias?
May I state this one more time? CUPC provides services. We don't force them on anybody. Provide services. Ms. Beecher, you were on that board a couple of years. You should know that yourself.
I know it, but people are listening to us and will view this, and I think it's good for a clarification for the public who will be, some people do watch us, so I thought it was important for a clarification that people would know this.
Okay, let's move on to the vote. All those in favor?
Aye.
All those opposed? Nay. Okay, motion passes. Thank you. Thank you, Dr. Weiss, for attending and being here in this cold evening with us. Great. Jim, the next two items, there might be some questions regarding the approval. Request the approval of an ordinance amending Chapter 5 of the Health Ordinance of Champaign County for retail food program ordinances. Anderson? Oh, Anderson moves it. Second? Second by Clifford. Discussion? Chris?
Thank you. I saw, do I read this right? It says here they want to eliminate terms critical, non-critical, in favor of using other terms like priority foundation, or core violations. Could you explain why that is wanted?
What happens is that the Illinois Department of Public Health adopts a food code, and in this case, they adopt a model food code from the FDA, and the FDA eliminated the terms critical and non-critical violation, and they substituted priority foundation, and core ones. Yes, I shake my head at it too, but that's what they did. So they're, it starts with the FDA. They produce a model food code.
Chris?
Do we have to adopt that, or can we amend this back to a more understandable?
The state of Illinois adopts it, and they require the local health departments to adopt their code. So there's one code throughout the state. And it's a big change for everyone. The critical, non-critical was back in 1976 what we would call the model food code at that time. And so, yeah, it's a big change. It's a big change for the health department, too.
Pastor Spotty?
Yeah, so when you're saying, when it says eliminating enforcement actions triggered by a rating score, so are there still enforcement actions, and what triggers those?
There are enforcement actions. State of Illinois has told the health departments they need to adopt the new food code. They need to adopt a new food establishment inspection report. They need to have timely correction of priority and priority foundation violations, and to do something regarding repeat violations. And so the triggers are in the enforcement procedure. And so we may find a violation, and if you correct it on site and it's not been a repeat, that's great. Sometimes we might find the same priority violation, for example, cold holding improperly. And if it starts to become a repeat, we're going to have different solutions to that. So it will go down a path, and it's a progressive enforcement procedure. And I think you asked, was there another question in that, or did I answer that okay?
Quisenberry?
Yeah, thank you. That's kind of what my question was going to be. If I was a restaurant owner, what would be the practical changes that you would expect them to see in how this operates?
Well, I've had some open houses. We've been doing this for 2 years. I've had some open houses. So I kind of explained what the key changes would be to them. Like they would have to have someone called a person in charge now, available at all times. There were some other rule changes, some name changes. So we went through those things in probably the first year of this 2-year process. Now, with the compliance and enforcement procedures, I sent out a postcard to every county food establishment, every CUPHD food establishment as well, and inform them where they could see the changes, who to contact, which would be myself. We sent out total about 1,300 cards. I got 5 responses back asking how it would affect them. And then as the inspectors went out too, as we do inspections, we're trying to explain how this is going to affect them. Now also too, I think in 2019 when this takes effect, because it is so new for the health department too, I think we're going to have a period of education where you're the operator, we're going to talk about what your issues are, and here's a new form, this is what it looks like, and this is how enforcement's going to take place. And so, like for example, a repeat violation in 2018 will not, to me, will not carry over to 2019, and we'll have to talk about how we go from there. You know, so I think 2019 is going to be a period of adjustment, both for the operators and for the health department and for the public too, to understand those new forms.
Okay, once we get past that, what we'll call that period of change as we're
Okay.
adapting to it, would you expect that operators are going to be better able to understand how things are going to work from time to time than they are now? Will it be an
Right.
improvement in consistency?
I think so. I think what's going to happen is that we're going to emphasize the violation, not a score, not a certain number of things. We're going to look at the violations, and so they're going to understand if you have a cold holding problem, you're going to have to make changes to how you solve this problem. It could be equipment, could be behavioral. The public health department will interact with them and try to solve this problem. You know, for example, we did a study a few years ago on repeated critical violations, and we started to use this root cause analysis by asking why 5 times. And we were really able to get great compliance of reducing these repeat violations by simply interacting with them on that kind of a basis. So that's one of the solutions that you would see in the enforcement procedure, was this root cause type thing, because we found out it worked very well. So I think over time, they will understand that we're looking at really the big stuff and not some of the smaller stuff that might be a compliance issue in the code. Fact is, if there are core violations, let's say small holes in the wall in the kitchen, we may write that, but we're going to come to a point where the health department is no longer going to worry about enforcing that because it's not going to matter to someone's health. And so I think we'll be worried about the big stuff, the priority and priority foundation violations.
Great, that sounds like an improvement.
And I think that's, and it's, again, based on the FDA Model Food Code and the Compliance Enforcement Chapter, which is not adopted by the state. But that was one of my goals, is to incorporate the things that FDA has proven over time to say, look at these violations and try to find some short-term and long-term behavioral changes.
I was reading in the literature that you also do training. Is that a standardized training? You do that once a year, twice a year, or you do it with each individual vendor as you go along?
Well, you know, the inspection itself is a training opportunity where we can talk about how to solve a problem. You know, here we see this problem, how to solve it. I just went to another restaurant, they had a similar problem. This is how they solved it. So the inspections themselves are training. I don't know what training you were referring to, but we do a standardization exercise where I'm the standardization officer because I've been, we do joint inspections, and so we try to see how close we can get to the same type of violations. You know, there's some margin of error here, but we see how close we can get. And so I'm standardized by the state, and then I go out and standardize my staff. So we do these joint exercises. We have to do a standardization exercise every 3 years.
And then I also received a call from a young vendor that wanted to get his grandmother into business and wanted to do the small two-wheel carts, selling snow cones or selling tamales, just so that that individual could make an earnest living. Is there any regulations towards that? I know that we just got into food cart and food cart regulation as of recent.
Anytime you serve food to the public, we have regulations that are involved.
Okay.
And we can help them, you know, I mean, you don't have to build a whole kitchen. Oftentimes we have a rental kitchen or an incubator type kitchen. I mean, Marbles in Savoy must have 15 to 20 different individual mobile food trucks, for example, operating out of their kitchen, their commissary kitchen, so.
So it has to be a certified kitchen, in other words?
It has to be a permitted kitchen, yes.
Okay, great. Well, thank you. Are there any further questions?
Yes, and we
Chris?
do push carts, mobile trucks, you know, because I'm asked that question all the time, too.
Oh, okay. Okay, Chris?
Thank you. Going to Chapter 6, Private Sewage Disposal Systems, notice that there's a number of acts that are prohibited, and then it kind of ends down to standards and regulations, but nothing follows. I assume that there are more standards and regulations that are not listed here?
I think it's my understanding that I gave the whole health ordinance, and Chapter 5 is what was struck through. However, I think in your packet, you only got the chapter that pertained, Chapter 5. And yes, Chapter 6 follows this, but there's no changes in Chapter 6 through Chapter 11 or something like that. So it was just a smaller amount of paperwork for yourself.
Thank you very much. Jim, could we go on for the vote then? All those in favor? Aye. All those opposed? Motion passes. Number 3, request approval of Champaign County Public Health Department Retail Food Program Enforcement Policy. Could I get somebody to move that? Anderson moved, second. Summers, second. Discussion. Questions? All those in favor? Aye. All those opposed? Motion passes. Thank you.
Thank
you very much, Mr. Roberts, for attending today and giving us this wealth of information. I'm ready to go to business. Okay, County Clerk, I move to put that report on file for the County Clerk as well as for the County Administrator. And then we move to item G, which is other business, a resolution supporting the realignment of Region 2 which is the East Central Economic Development Region, and the addition of Douglas County into the Local Workforce Investment Area LWIA 17, realignment of Local Workforce Innovations Area LWIA 17. This is just adding another county to what we currently have. I believe it's, okay, moved by Anderson, second. I heard something over there. Chris. Okay. All those, before we vote, any questions, discussions? I'll get the hang of this before the end of the year. Okay, seeing none. All those in favor? Aye. All those opposed? Motion passes. Thank you very much. Chair's report, county executive appointment expiring December 31st, 2018. That's for information only. And then we move to the last two items.
Quick question about that. Do we
Yes,
know
Quisenberry.
which members of the CU Mass Transit District's positions are up?
Biased?
I think they're Democrats. Two Democrats, I think. One for Champaign, one
But
for
you don't know
Urbana.
which
It's
ones?
Dial and Chaplin.
Oh, thank you.
Okay, thank you.
And for the county mental health board, there's two also? Do we have the names to those? I guess we don't, and not at this time. There's no action to be taken on those designated items to be placed on the consent agenda. Deb, correct me if I'm wrong. B1 through 5? Huh?
B3, there was a, Mr. Patterson did not vote, so therefore that cannot
Okay,
go on
so
consent.
it's B1 and 2, 4 and 5. C1?
No.
No, okay. D1 through 3, no? D2 and 3, and G1.
Correct.
What was that?
C1 doesn't go?
Doesn't go to the board.
Okay. So our secretary got that. You all don't need to know that.
All right, thank you,
To the
Mr.
next county
Rosales.
board meeting.
Next up is Finance, Ms. Furtado.
A1 Budget Amendment 18-00057, Fund 091 Animal Control Department 248, Animal Impound Services, increased appropriations $8,700, increased revenue $4,500. Do I have a motion? Mr. Patterson, second. Mr. Goss. Discussion. Seeing none, all those in favor? Aye. Thank you. Budget Amendment 18-00060, Fund 075, Regional Planning Commission, Department 886, Garden Hills Energy Efficiency Initiative.
Point of order, you didn't do a post on the previous one.
I did. I didn't? Oh, I'm so sorry.
Sorry, I just want to make
Oh,
sure
I
we don't
thought
have to
I
do
did.
this again.
I thought I did. In my head, I did. All right, sorry about that. Is it too late? Opposed? Opposed? Thank you, sorry, in my head, I thought I did. Budget Amendment 18-00060, Fund 075, Regional Planning Commission, Department 886, Garden Hills Energy Efficiency Initiative, increased appropriations, $210,000, increased revenue, $210,000. Ms. Card first moved it, second by Mr. Tinsley. Discussion? I just would like, one point I'd like to say is I appreciate RPC providing memos that are sort of letting us know more about these programs, so thank you for that. And there was a question over here?
Yeah,
Mr. Storr.
I was curious how many people were going to be hired for this?
I think skip two. I don't think you can hire three on $90,000. So I'd say two people.
Any other questions? All those in favor? Aye. Opposed? Okay. Thanks. Budget Amendment 18-00062, Fund General Corporate Department 036 Public Defender, increased appropriations $1,692, increased revenue $1,692. Do I have a motion? Mr. Patterson, second by Mr. Tinsley. Discussion? Seeing none, all those in favor? Aye. Opposed? Okay. Budget Amendment 18-00063, Fund 476, Self-Funded Insurance, 118, Property Liability Insurance, increased appropriations, $381,000, revenue none from fund balance. Do I have a motion?
Move.
Sorry, I saw Mr. Rosales, second by Mr. Anderson. Discussion. Ms. Petrie.
Thank you. I asked the question of Ms. Busey earlier today as to how much has been expended on liability insurance for 2018 and 2017. Ms. Busey, did you bring those figures with you so you can share them with everyone?
Sure. So in terms of the insurance premium line, in 2018, we have paid out $881,186 so far, and we'll pay an additional $89,500 in December for the first month of our 2019 renewal. The shortfall in this insurance premium line in 2018 is due to the fact that the self-funded insurance fund paid the annual premium for the nursing home in the amount of $120,000 for fiscal year 2018. The total amount paid in liability insurance premiums in 2017 was $837,501. In terms of claims, which is the other line that's on this budget amendment, which, by the way, is in your yellow packet, in fiscal year 2018, we have paid out $2,015 of the $240,701 budgeted. The requested increase of $365,000 is in anticipation of settlement of some significant claims that we believe will potentially be resolved by the end of this fiscal year. In fiscal year 2017, we spent a total of $28,888 in general liability claims.
I have a question. If they are not settled by the end of this fiscal year, will we need to revisit this in 2019?
We have a fairly reasonable budget for claims in 2019, but it's possible we would still need an amendment. It will just depend on how things go.
Okay. Thank you. Any other questions or comments? Seeing none, all those in favor? Aye. Opposed? Thank you. Budget Amendment 18-00064, Fund 476, Self-Funded Insurance, Department 119, Workers' Compensation Insurance, increased appropriation $125,000, revenue none from fund balance. Do I have a motion? Sorry, I saw Mr. Clifford, second. Ms. Petrie. Do I have any questions or comments? Ms. Petrie.
Again, I posited same type of question to Ms. Busey on our workers' compensation, and if she would read out what she sent to me, that would be appreciated.
In fiscal year 2018, we have spent a total of $787,684 in workers' comp claims. We were able to reach final settlement on 6 large outstanding claims in 2018, which totaled $277,350, which is included in this total. In fiscal year 2017, we spent $545,912. The increase is substantially related to the settlement of some large claims.
Any other additional questions or comments? Seeing none, all those in favor? Aye. Opposed? All right, thank you. The next item is Budget Amendment 18-00065, Fund 080, General Corporate Department 041, State's Attorney, increased appropriation $65,000, revenue none from fund balance. Do I have a motion?
Second.
All right, sorry, Mr. Patterson, Mr. Rosales, second. Questions? No questions? All right, Mr. Vashapati.
Do we have sort of a timeline for the case, I guess? No.
I can tell you the case is scheduled to go to trial in January. So this year, fiscal 2018, has seen the largest investment of expenses as the state's attorney is preparing this case for trial in January.
Thank you.
Okay. Any other questions or comments? Seeing none, all those in favor? Aye. Opposed? Thank you. Budget Amendment 18-0006, Fund 076, Tort Immunity Tax, Department 075, General County, increased appropriation 42,000, revenue none from fund balance. Do I have a motion, Mr. Anderson? Second, Ms. Court. Discussion. Seeing none, all those in favor? Aye. Opposed? Budget Amendment 18-00067, Fund 080, General Corporate, Fund 040, Sheriff, increased appropriations, $11,024, increased revenue, $21,611, and this is in relation to the Luke Bryan Farm tour, where revenue exceeded expenditure for security for that concert. Do I have a motion? Mr. Esri, second by Mr. Patterson. Discussion. Seeing none, all those in favor? Aye. Opposed? Budget Amendment 18-00068, Fund 080, General Corporate, Department 040, Sheriff, increased appropriations, $58,083. $58,083, I'm going to say it like that. Revenue, none from fund balance. Do I have a motion? Sorry. Mr. Summers, second. Mr. Vashapati, sorry. Didn't see you there. Discussion. Seeing none, all those in favor? Aye. Opposed? Thank you. So that is that part of the budget. We're up to the treasurer. We'll put the monthly report on file. And are we having a general corporate fund cash flow report presentation? What, not by the treasurer? Okay, so we will move to that section. Moving on to the auditor. We'll put your report on file. Our auditor is here. Do we have any questions? Thank you very much. For the circuit clerk, Section D, request approval of an intergovernmental agreement between Champaign County, Illinois, the Champaign County Circuit Clerk, the Village of Mahomet, Illinois, and the Mahomet Police Department for electronic citation program fees. Do I have a motion? Mr. Anderson, second by Mr. Goss. Discussion. Seeing none, all those in favor? Aye. State's Attorney, renewal of state... Oh, I'm so sorry. Opposed. In my head, I'm saying it. Sorry about that. Opposed. Seeing none? Okay. Moving on. Renewal of State's Attorney Appellate Prosecutor Programs fiscal year 2019. Do I have a motion? Sorry, Mr. Anderson, second. Mr. Esri. Discussion. Seeing none. All those in favor? Aye. Opposed? Okay, seeing none. Information Technology, recommendation for award of a contract to DevNet, Inc. pursuant to RFP 2018-003 for integrated property tax assessment, extension, and collection system. Do I have a motion? Mr. Goss, do I have a second? Mr. Summers. Discussion. Mr. Storr.
Thank you. Is there anybody here to good. Thank you. I was curious, what is the anticipated cost of this software?
The first year is going to be about 98,000 and probably about 85 a year after that.
Was this the low bid or could you, and is this?
It wasn't really a bid. It's we requested vendors that provide this type of software systems to provide us with answers to a specific set of questions that we had for them regarding their software, and to also provide us with the anticipated estimated pricing of what their software might cost. But then we evaluated it based on several different criteria and selected a top vendor, and DevNet was the top vendor. Their price is competitive. If they're not the lowest, they're the second lowest.
Thank you. Is this a proprietary program? And
yes.
Okay. And is it possible if at some time in the future, since we're starting out with this, this will be kind of a new thing for us. We're going down a path. Is it exportable to other software that's used in the county or compatible with other software used by assessors in Champaign County?
Well, right now, everybody uses the AS400 and our custom-developed software programs. So this will replace all that, and it will also give the township assessors and the multi-township assessors access to a CAMA-based assessment system.
Are all of the assessors pretty much happy with the idea of doing this, or are there any dissension, or is there a competitive? Are they using existing software that will work well with this?
Well, the smaller townships don't really have anything. They use a combination of what we have on the AS400. And then they also use some state-supported software for doing market studies and sales studies and things like that. It's my understanding that the state-supported software, which is called ICAS, is going away in the next couple of years. So we anticipate that, well, we know for a fact that City of Champaign is very interested in DevNet. We believe Cunningham Township is also, they have a CAMA-based solution right now. And my last time I talked to Wayne Williams over there, he was interested in possibly converting theirs to DevNet as well. I think Champaign Township has a CAMA-based solution that is, they can export their data to DevNet, and then we can import it into DevNet. But then again, if any of the townships want to switch to DevNet or purchase DevNet, they can do so.
Mr. Vashtispati?
Yeah, thanks. I have a couple or three questions. First, so is the county bearing the cost for this, or will we share it with the assessors who are also using it?
When we get further into the township portion of it, we hope to come up with a formula that will help subsidize it for the townships. Specifically, the smaller rural townships that are tax capped and don't have any growth have no way of raising money to pay for something like this. So we're hoping that we can come up with a mechanism where we can subsidize all the townships to the extent that it pays for some of the smaller townships and multi-township assessment districts, but we haven't developed the formula for that yet. And we'll bring that back to you guys for approval during the budget cycle next year.
Thanks. Second question, so sort of following up on what Mr. Storr asked, my understanding was that the county had planned on sort of switching many of its systems from the AS400 in the next couple of years to a Tyler Technology system. Will this be able to integrate with that at all, or will it?
There's not really much integration between the real estate system and the general ledger system. Basically, the real estate system is kind of a separate accounting system of its own that tracks and distributes the real estate collections to all the different taxing districts, including the county. So we could have a direct link between what's collected for the county and between the GL, so that we would have, less paperwork in moving the money around. But the integration with the other townships, the other districts, we'll be working with that and their ERP systems and whatnot to try and get direct feeds to them.
Okay, thanks. And my last question, I know this might not make it any less painful for me to pay my property tax bill, but will it make it any easier for the user?
Well, I don't know, it's pretty easy now, isn't it?
I just bought a house this year, so.
Oh, well, I mean, right now you can pay at any bank in the county, that won't change. You can pay in the treasurer's office, there's a drop box out in front of Brookins. They take credit cards on the website, they have an 800 number you can call to use a credit card, you can do advance pays. So, you can do ACH transfers, things like that. So, I mean, they've got a number. We don't anticipate that any of that is going to go away. And it's possible that DevNet might have some additional capabilities for accepting payments. But I think Dan Welch did a heck of a job making sure that it was pretty easy for everybody to pay their property tax bills.
Thanks.
Mr. Quisenberry.
Yeah, good evening, Mr. Rhodes.
Hey, Quiz.
Quick question, if you don't mind indulging me a little bit. What's their kind of baseline technology that this is built on?
.NET.
.NET, okay, thank you.
They don't have a cloud product, but it's possible that we could spin it up in Azure when we start to move more in that direction.
I wasn't going to ask that, but thank you for adding that, because you knew how I think. But my other question would be, I see the list of the evaluation team. Was there anybody from the townships or maybe another IT specialist involved with the evaluation?
Just Leanne Brehab-Riley, the director of the GIS consortium.
Yeah, I know she has some technology capabilities, but I guess I would recommend in the future when we're looking at products like this, we might want to utilize one of our partner municipalities, someone like a Sanford Hess or some of the other areas, to have like a third person in there that's a little more objective in evaluating these systems. It looks like this has turned out very well, but I always like to have an extra set of eyes on it.
We'll keep that in mind.
I have a couple of questions. One, if one of the rural townships or any township is unable to or unwilling to convert to DevNet, and I'm glad that that's something that you're going to try to work with folks on going forward. Will it pose any difficulties for them?
No, because they can still come into the assessor's office and do their work on the computers in the assessor's office.
Okay.
This would just strictly give them the tools to do a lot more field work.
Okay.
And also to have remote access to the database from their offices or from their homes, which is where most of the multi-township assessors and rural township assessors work from.
And is is DevNet used in the counties near us?
Yeah. There's quite a few of the overlapping counties are currently using DevNet. None of the overlapping counties have their own software package like we do.
Okay.
There's only probably a half a dozen in the state that still have custom packages. So yeah, most of the overlapping counties do use DevNet. Piatt County, which is where Paula Bates, our supervisor of assessments, came from, uses DevNet, and she has quite a bit of experience with DevNet from there.
Any other questions? Seeing none, all those in favor? Aye. Opposed? Thank you. Thank you very much. Next up, we are going to hear the county administrator's reports. Thank you, Tammy.
These are in your yellow packet. Starting with a revenue projection report for fiscal year 2018. At this point, we are anticipating the county will bring in approximately $240,000 more than the original FY 2018 budget. A large portion of that is being driven by increases in revenue stamp revenues, which are under the non-business licenses and permits line. So I know that you approved a budget amendment for the recorder's office I believe it was last month, because of the strong real estate market. And as I had mentioned, per Mr. Sheldon, a significant part of that is being driven by large commercial transactions. And so in October alone, after you approved the budget amendment last month, we saw $404,000 in revenue for revenue stamps. So I believe that Mr. Sheldon will have to be coming back to you for another budget amendment because 2/3 of the revenue that is collected for revenue stamps is then turned around and distributed to the state. And the other thing I want to point out on the revenue report is I have mentioned over the last couple months that the county has seen some increases in fees and fines over what we were have been originally projecting at the beginning of the year. And one of those things that I mentioned for fines last month was that there was a $110,000 disbursement that was made in 1 month, which was a significant increase over what we normally see. In communications with the circuit clerk's office, this was due to catch up from the tax intercept payment system, which is the local debt recovery program. So whenever there are outstanding fines that are owed, if they're submitted to the local debt recovery program, then those can be collected through tax refund prior to a disbursement of a tax refund, and also through wage garnishments for state employees. So that is what that large transaction was associated with.
Really quick, can I just ask you one quick question on the stamp additional revenue coming in? Do you anticipate that appropriation in this fiscal year or in the next fiscal year?
In this fiscal year.
So you think it'll come to us in December? The additional appropriation?
I think, well, we are already anticipating, I mean, we're already above what the budget is for this fiscal year. So, yes, Mr. Sheldon will be requesting a budget amendment, I believe a second budget amendment for fiscal year 2018 in order to disperse that portion that's owed to the state.
Okay, thank you.
And for 2019, we did increase this line. I believe we budgeted 1.5 million, and at this point, it's just too early to tell whether that will be, adequate.
Mr. Goss?
Yeah, I do know. I think he's probably holding off because there was another big transaction this month. So he's probably trying to get the big transaction, so maybe he only has to come back one more time.
Right. So we'll probably see that in December then?
I think he probably will have to bring it because I don't know what the time span is for submission to the state, but my guess is that, yes, it would come in December.
Thank you very much.
And then on the expenditure report, last month you also approved a budget amendment for payment to RSM on behalf of the nursing home upon closing. So that amount has been is reflected in the all other services line. And also under the transfer category, the nursing home fund has been increased an additional $500,000 in anticipation of forgiveness of the nursing home loan that you'll consider later on the agenda. So I really kind of skipped over the totals, but total expenditure for 2018 at this time is estimated to be $308,000 over the original budget. And for the summary page, you can see with the combined revenue and expenditure changes, there is a revenue to expenditure difference projected at $416,000, which translates to a fund balance projection of just under $5 million or 13.4% of the 2018 expenditure budget. For the budget change report, the two budget amendments that were approved in October were the recorder's revenue stamp request for increase, and also the general county payment to RSM that will be made on the closing of the home.
Mr. Goss?
Yeah, I don't see it on here, but which I assume you'll bring to us next month. We approved about 600,000 tonight of budget amendments. I assume that comes next month?
Only the ones that are related to the general fund
Okay.
will be added for next month.
All right, thanks.
Do you have a sense of where that'll put us?
I already, there were only the 65,000 for the state's attorney, and the public defenders was budget neutral. The sheriff, he had one that actually will be a surplus for the county, right? And then I have already anticipated in my projections the increase for the salaries.
Mr. Vasquez-Paddy?
Yeah, just to clarify, when you say the budgeted revenue does not include the 474,199, that's captured in this minus 545,269 budget variance in the first line under property taxes?
Correct.
Okay, thank you.
Any other questions? Thank you very much. Okay, so now we are going to the annual budget and appropriation ordinance. And 1 second as I turn to that page. Okay, fiscal year 2019 annual budget and appropriation ordinance. Do I have a motion? Mr. Goss, do I have a second? Mr. Rosales, any discussion? Seeing none, all those in favor? Aye. Opposed? Okay. Next, fiscal year 2019 annual tax levy ordinance, Champaign County, Illinois. Do I have a motion? Sorry, Mr. Harper, second. Mr. Anderson. Killing me. All the discussion. All those in favor? Aye. Opposed? Resolution for giving loans from the Champaign County Corporate Fund to the nursing home fund authorized by resolution number 29892 and number 10097, renewed by resolution number 10188. And just a procedural question, that we have to vote on this and then A, correct? Okay. So right now, we're just voting on 4, the top part, okay? Do I have a motion?
Moved.
Mr. Rosales, a second by Mr. Summers. Discussion. Seeing none, all those in favor? Aye. Opposed? Okay. Now, for the A part, Budget Amendment 18-0061, Fund 080, General Corporate Department 075, General County, increase appropriations 500,000, revenue none from fund balance. Do I have a motion? Mr. Vasquez-Paddy, second. Mr. Summers. Discussion. Mr. Goss.
Yeah, just to get this on the public record, this will be tracked for future use.
Can you expound upon that a little bit?
Sure, this goes back to like the 282,000 that we forgave for some debt payments, and also this 500,000 that we loaned last year. So we're keeping track of this money. So if there's a way to recapture it after the sale of the nursing home, we will recapture this money to put it back into the general fund, general corporate fund.
Thank you. Thank you. Any other discussion or questions? Seeing none. All those in favor? Aye. Opposed? Thank you. Other business? Seeing nothing. Chair's report, I don't have anything. Except for thank you for bearing with me today. The items to be placed on the consent agenda, I have A1, A2, A3, A4, A5, A7, A8, A9, D1, E1, F1, G2, G3, G4, and G4A.
Thank you, Ms. Furtado. Moving on to other business, I would like a procedure motion to have the Champaign County Board Chair inform the United Counties Council of Illinois, also known as UCCI, of its interest in accepting, if offered, the proposal by the UCCI to pay for Champaign County's annual National Association of Counties fees. Moved by Mr. Goss, second by Mr. Storr. Discussion? Ms. Petrie?
Yes, and I should have asked Mr. Zimmerman this question. If we accept this, are we then putting ourselves in the obligation of joining the new organization in any way, shape, or form?
This is an offer from UCCI, has nothing to do with that organization.
All right.
Further discussion? Seeing none, all in favor? Aye. All opposed? Motion carries. Next up on the addendum, we have a closed session. Who has, Mr. Patterson has it tonight.
I move that we entered into closed session pursuant to 5 ILCS 120-2C11 to consider litigation which is probable or imminent against Champaign County. I further move that the following individuals remain present: County's Legal Counsel, Deputy County Administrator of Finance, Interim County Administrator, Recording Secretary.
Is there a second? Second. Second by Mr. Rosales. Roll call, please.
Tinsley,
Yes.
Vashaspati,
Yes.
Anderson, Clemens,
Yes.
Clifford, Coert, Eisenman,
Yes.
Esri,
Yes.
Furtado, Goss,
Yes.
Harper, McGuire, Mitchell, Patterson, Petrie,
Yes.
Quisenberry,
Yes.
Rector, Rosales, Storr, Summers, Weibel.
Yes, we'll go to closed session. Members of the public, there will be no action after this closed session. Thank you.